to hand the reins over to you.
Well, thanks so much, Sadie. Everyone, hi, Jalen Jackson, Senior Marketing Specialist. I'm our Compliance Officer and a member of the Key Accounts team for anyone who doesn't know me. We are going to go over some compliance basics today. This is not intended to be a comprehensive look at any compliance changes for this year. We've already done several webinars about that, and we do have recordings available. That said, if you do have questions, pop them in the chat, the question box, and we will be happy to get to them. I tend to go through the presentation first and hit questions at the end. So please pop those in there as you think of them, and we'll be sure to get to them. So anything compliance related that's on your mind, happy to talk about, but going to focus a little bit on compliance basics, just some general compliance knowledge for you, whether you're an agent doing your own administrative work or whether you are administrative staff for an agent or agency. That's really who a lot of this is geared toward. I'm going to go over a number of different topics today, starting with some of the very basics, kind of trainings and exclusion screenings. So as an agent, if you're starting to think about hiring people, or as an agency who has several staff, just a quick reminder and explanation that under the rules with CMS, anyone working with Medicare Advantage and prescription drug plans or Medicare beneficiaries, you must be screened against the Office of Inspector General and General Services Agency exclusion lists. It's called the List of Excluded Individuals and Entities. These are people who, for various reasons, are not allowed to receive any payments from the federal Medicare program, usually due to things relating to fraud or other financial crimes against the Medicare program. So any staff that you hire has to be screened against those lists before you hire them, and every month, every 30 days. So need to be screening those, saving those on file for 10 years. What we use here in our office for any pre-hire exclusion checks is a system called Verify Comply. I think that link's going out in the post email. It is super handy. I would say if you have less than 10 to 15 staff, that's probably one of the most efficient ways to do it. If you have more than 10 to 15 staff, there may be some other systems out there that will automate it for you a little more. But Verify Comply is perfect, ideal for pre-hire exclusions for anybody and for ongoing exclusions for your smaller agencies and offices.
Does it cost anything?
For the basic exclusion list checks, it does not cost anything. Now, I haven't looked at enough to know if there's like a cap on how many you can run every month or anything like that. But
for smaller agencies anyway.
So we only use it for our pre-hire exclusion checks because our monthly checks are 120 people.
Right.
So we have a different system that automates that for me. Otherwise, I'd be spending a lot of time doing that every month. But again, if you've got, say, less than 10 staff and employees, definitely a great solution. Similarly, fraud, waste, and abuse and compliance training. All agents and staff have to complete fraud, waste, and abuse within 90 days of hire and annually thereafter. If you're an agent on this, you complete that as part of your AEP, NABIP annual certification process for Medicare Advantage and prescription drug plans. But if you're a non-licensed staff or administrator, you should be completing this course from CMS. It costs nothing. It's directly on the CMS website. You punch your name in at the beginning, go through the course, and it prints off a great little certificate that you need to keep on file for 10 years. Super easy and simple, just within 90 days of any new staff starting and annually thereafter. So makes it pretty easy.
Yep.
Call recording has definitely been a big topic the past year or so, and we did have some updates so that I'll go over for this coming season. So starting September 30th, 2023, only sales, marketing, and enrollment calls need to be recorded, and that does include the audio portion of virtual meetings like Skype or Zoom or RingCentral or whatever online meeting system you're using. So do have to record and store those for 10 years, but again, right now today, the standard is still all calls with beneficiaries. Starting September 30th, only sales, marketing, and enrollment calls. Now, the good news for any of you admins out there, if you're a non-licensed administrator, you really shouldn't be conducting any of the sales, marketing, or enrollment functions. So most of your calls would not need to be recorded. If you are a licensed admin or, of course, an agent and may perform these sales, marketing, or enrollment functions, you need to make sure you have a system in place to get those calls recorded. So In some cases, something like Medicare Center may be a great option for you. In some cases, you may need to look at your overall phone system, whether you use a voice over IP phone system or a old-fashioned landline. Talk to your current phone service provider to get kind of a whole office set up for call recording, and then make sure you look at your storage options, because again, we've got to keep these for 10 years, and most of your recording softwares are not going to also store for 10 years.
Right.
Medicare Center, however, will.
Yeah, absolutely. I know that in the past, there has been a little bit, people have like, well, Zoom and Skype and like those virtual meetings, that's kind of a gray area. But I know that this year that they have come out with, no, those count as calls. You have to count those don't count as face-to-face, those count as calls, so you have to have those stored. So I just wanted to highlight that a little bit, because I know that last year whenever we did this, it was a little bit like, are they, you should just in case, but like, but now we know. So,
and to be clear, only the audio portion. So if it's a video meeting like this, you don't have to record the video portion. Well, you don't have to keep the video portion.
Right.
Normally you're going to record the meeting with the record button, and it's going to pop out a couple different files, an audio only file and a video and audio file. So you only need to save the audio portion of that call.
Yes.
Scopes of appointment, definitely wanted to go over this for pretty much everyone on the call today. So whether you're an admin or an agent, these are great updates. Of course, scope of appointment been around for over a decade now, hard to believe, but just that form that indicates which products a client is willing to discuss with an agent. There's those boxes that they'll initial that talk about which products they want to discuss. And we've had to collect those for quite some time now prior to presenting a plan. Now, with the CMS updates for this year, we have to collect a scope of appointment a minimum of 48 hours prior to presenting a plan or enrolling a beneficiary into a plan. So there are two exceptions, one of which has a lot of controversy. The 48-hour rule can be waived, and I want to clarify, you still have to collect a scope of appointment. It is the 48-hour rule that is waived in these cases, not the rule requiring a scope of appointment. If a beneficiary is in the last 4 days of their enrollment period, you can collect the scope and immediately proceed to a presentation. Or if they are a walk-in, if they just walk into your office to a kiosk, to a registered sales event, you can collect the scope right away and waive that rule. So big skepticism from a lot of people on this. There's been a lot of misinformation and kind of conflicting information regarding walk-ins. Citibank was, I think, the first one that came out and said, well, someone at CMS told us that inbound calls are going to count as a walk-in. And they did that as a part of them reviewing the big publicly traded call centers' stock performance and said, well, we think they'll be okay because someone at CMS told us this. So we definitely have kept an eye out for information regarding that. There's been a couple carriers that have also said inbound calls count as a walk-in. However, what I would caution folks, and it's not that I believe that that's not going to happen, but CMS hasn't said it publicly yet.
Right. Yeah.
A couple folks have said CMS told us, but CMS has not said that publicly yet. So I wouldn't bet the farm on inbound calls counting as a walk-in. Doesn't mean that they won't. That absolutely may come to pass that inbound calls count as a walk-in, but we don't know that for sure yet. So that's my caveat.
Do you think that that's something that will just kind of be gray area for this year, or do you think we'll know by October 1st whether or not that counts?
We should know before AEP. So CMS has a number of things that they specifically said they will release in sub-regulatory guidance closer to annual enrollment, which could come out any day. I could have an email when we get out of this webinar, which would be very frustrating because I wish I could have shared it with you. But yeah, they do put out sub-regulatory guidance every year, usually between the release of the final rule and AEP. So, somewhere between May and October, and should clarify any kind of unanswered questions, because there always are.
Yeah.
There's always questions.
Absolutely.
So last point on this slide, scopes are valid for 12 months from the client's signature until you use them in the presentation or enrollment into a plan. So meet with the client, present a plan, need to get a new scope before you can have another appointment with them. And again, 48 hours prior to that appointment occurring. So my big takeaway for agents everywhere and for any administrative staff is start treating yourself like the dentist's office. Someone comes in for an appointment, they don't leave without their next one and without signing a scope for that next appointment. Even if you don't know when that next appointment's going to be, just go ahead and get the scope. They're good for 12 months. Even if it's next AEP, then you've got it. You're in good shape.
Absolutely. I know that on Monday we got a lot of questions about all of this, the scopes, just as we were kind of going through AEP toolkit and stuff like that. So if you have any lingering questions, please feel free to throw them in here. We are getting a few on here,
Yeah,
but I know that one thing that we have been suggesting to people and that we got questions about is, are we allowed to send out scopes right now to get them signed so that way we can talk about AEP? And we said yes.
Yes.
We actually recommend that you start doing that
Heavily,
because
heavily
that way
recommend
you
that.
don't have to worry about that during AEP. You know that you're able to talk to everybody. You know that you're compliant. You have it on file, all that good stuff. And then, like you said, before they leave, making sure that you get another one signed. But yeah, just wanted to throw that out there. If you are able to start throwing out those scopes appointments, get those signed, get those back, so that way you have those on file in plenty of time for AEP.
Absolutely. No reason not to get those out there right now. So a couple quick notes on submitting applications. So if you're, of course, an agent or if you're an administrative person who helps submit applications, specifically paper apps, electronic apps are a little easier and a little more clear. But CMS standard is to submit all applications within 48 hours of the agent receipt and signature. Some carriers, however, do require a little bit tighter timeline, in some cases 24 hours. So if you are getting those getting paper apps, make sure those are getting sent in either directly to the carrier or to our enrollment team as soon as you can within that 48 hours, preferably within 24, especially if you're sending them into our enrollment team. And if you do plan to use our enrollment team, which can process not only your MA and PDP apps, but any applications for contracts you hold through senior marketing specialist, make sure that you are taking a look at that app submission agreement, signing it and returning it to us before you submit any apps to the enrollment team. So we are more than happy to do that. Louise and the team with enrollment does a great job of checking those apps over, making sure there are no errors or missing information. I don't think it's the case anymore, but at one point in time, she would tell us constantly the number one error she would find on apps was that agents would forget to sign it.
Yep.
Makes it a little difficult to get those to go
through.
through. But again, point being, get those in fast and get them to us so we can review them for you.
That's another thing that we talked about. That's one thing that we're waiting for the 2024. We have the 2023 application. I don't know what the form is called, but that agreement form on the toolkit right now, and you will see in little italicized letters are words that we're waiting for the 2024, but keep checking that AEP toolkit because we'll have that up there soon.
And go ahead and fill out the 2023 one because you don't have to wait until AEP to start sending apps through our enrollment team. Well, you can do that right now today. So a couple quick notes, and again, this is all super 101 level stuff. If you have nitty gritty questions, please pop them into the question box and we'll get to them at the end. Contact with beneficiaries. So just a couple basic reminders. You can't just walk up to beneficiaries in public to discuss Medicare products. They can approach you, and if they ask questions, you can absolutely answer those questions, get permission to contact, set up an appointment with them, things like that. You just can't be approaching beneficiaries in public places to try to discuss Medicare products. You can absolutely email beneficiaries. So even if you just have their email from somewhere, you can email them as long as you're providing an opt-out and following all other TCPA and CAN-SPAM guidelines. So more than just CMS compliance, also have to comply with Telephone Consumer Protection Act and email spam laws. So you can also mail things. So postal mail, physical mail, postcards, letters, flyers, things like that. You can mail those out to beneficiaries that you have addresses for as well. With calls, it gets a little more complicated. You can only call people with which you have an existing business relationship, meaning they already have one or more products with you, or with their written consent, be that through a lead card, an online form, some other kind of valid permission to contact. And at that point, you can reach out to them by phone, or if they have specifically opted in, also text messaging. They do need to specifically opt into text messaging as well as phone calls. Big point here being they can revoke that consent at any time. It's not a hard calendar deadline stop on how long a lead is good for. They can revoke that consent, which makes it an invalid permission to contact. Some, again, super basic stuff on marketing. And again, ask as many questions as you can. We'll be around as long as you need us, within reason. But we'll answer as many questions as we can at the end. But marketing materials do have to be approved by CMS and the carriers you represent before they can be distributed. And real quick on this, because you'll see a couple key words here: marketing and communications. So in the realm of the Medicare world, everything that is consumer facing, anything that goes out to a beneficiary or that is put out in the public for beneficiaries to see, is a communication. Marketing is a small chunk of communications that are specifically designed to entice a beneficiary to look at a certain plan or plans, or to stay in their current plan, and contains information about those plans. Anything from names to benefits to various other like ratings information and things like that. So that marketing subset of materials is what has to be approved by CMS and the carriers you represent. So it does need to be approved by any carrier you plan to represent, even if it is a generic marketing piece. So that is a process that we can absolutely help you with. Communications pieces must follow CMS guidelines, but as long as they do not meet the definition of marketing, they don't have to go through that approval process with CMS and the carriers. A couple big things that I see most often as mistakes are: must use a compliant agent title, something like insurance agent, licensed sales agent, licensed agent. The United Healthcare Producer Handbook has some really great examples of what they consider compliant agent titles. And you have to use appropriate disclaimers. Even on communications pieces, there are some disclaimers that are required to be used depending on the nature of the piece and what you are saying in it. A couple of the other big things that are, more clarifications or specifications from this year: cannot advertise benefits in an area they're not available. And this really means even in some cases, perhaps accidentally. So, we all love to hate the Joe Namath commercials that talk about these, drastic givebacks or, Part B benefits that are, putting money back in your Social Security check for plans that are only available in 4 counties in Florida. Well, we're not going to see as much of that this year because we can't advertise those benefits if they're in an area that's not available. So just be looking at where you're sending marketing pieces to and making sure that any benefits you are talking about are actually available in the areas you're sending those to.
Yeah.
And then, of course, if you do have anything, and I tell folks, if you have anything at all that is client facing, anything that goes out into the world to promote your business, whether you think it is marketing, whether you think it is communications, send that on in so we can take a look at it and let you know whether we think it is communications, whether it can be tweaked a little bit to make sure it's communications, or whether it needs to go through this review process with your carriers and CMS.
That is taking, that will save you so much time, because it's believe it or not, CMS, has a lot coming in right now. And so if you're able to submit to us instead of just going straight to CMS, you don't have to wait a long time just to be denied by CMS. You can allow us to look at it, say, hey, you need to change this, and then hopefully you'll have, nice compliant things to send in, and you won't have to restart the process all over again after waiting for CMS. So could save you a lot of time. We're doing that an awful lot lately. So please feel free to send those in to us.
Of course. So one of the last things I wanted to cover, just some basics on data security and retention, specifically the retention side. Pretty much anything relating to an enrollment must be retained for 10 years. Leads, call recordings, scope of appointment, applications, any documentation you have relating to a client enrollment needs to be kept for 10 years. And the big thing is it has to be kept securely. You've got to have good data security. So whether you are keeping those digitally. It needs to be in a secure storage format, so a secure drive, whether you're storing it in the cloud or on a physical hard drive, something like that. And then, of course, if you are looking at physical paper files, the big thing is you want to have 2 layers of security. So whether that's 2 layers of encryption on your digital files or 2 physical security barriers, a locked filing cabinet in a locked room for any paper files, that's kind of the industry standard now, is that double layer security. Just making sure that anything that could relate to not just HIPAA, but any of your business assets is secured. Things like ransomware, malware are more and more prevalent than ever. Phishing attacks are occurring at a higher and higher rate every day.
And they're getting tricky.
And they are getting tricky. Absolutely, they are. So definitely something to be on the lookout for. And as with anything we've discussed today, this is super 101 level stuff. Reach out to the agent resources team here at Senior Marketing Specialist with any questions on details or any elements of this presentation that you have questions about. And with that, we'll start going through some of your all's questions. I'm really excited because I see quite a few that have popped in. Yes. So I'm going to keep popping those questions in as you think of them. I'm going to go back to the top and start answering those. And first of all, Michael, I didn't get to it, but good morning to you as well. I appreciate you saying that. And I know you asked about the definition of marketing. Hopefully I covered that on the marketing slide, those things that are a subset of communications that entice a beneficiary to look at a certain plan or plans or stay in the current plan that they're on, that also includes benefit or plan information.
Absolutely. And if you ever have any questions about things, just call our office. Mike, we know that we talk to you a lot. Just call our office and say, hey, is this communication or marketing? And we can kind of help give you peace of mind on that as well. Because sometimes individual examples, you just want to make sure, double check, call in, and we'll be happy to help you out with that.
For sure. So Lori's asking, don't have to abide by the 48-hour rule if someone calls in. So again, we kind of discussed that a little bit. That's really kind of up in the air right now, whether regardless of where those calls are coming from, inbound calls. If you pull up the Code of Federal Regulations right now, which is 42 CFR section 422.2274, for anyone who really wants to look that up. But if you read through there right now, the specifics for the walk-in provision specify an in-person walk-in is the means of waiving the 48-hour rule. Again, a couple carriers, a couple outside influences have said that inbound calls will be exempt from the 48-hour rule. When CMS publicly says that, I'll be shouting it from the rooftops. I'm sure everyone will be very excited. But until CMS says that publicly, I'm going to tell everyone to remain pretty cautious of betting your AEP on inbound calls, counting as an exception to the 48-hour rule. And again, there's a million fantastically easy ways to get scopes of appointment: text, email, physical copies, send them in the mail with a return envelope. There's plenty of ways to get scopes well in advance of AEP. Start collecting them right now today, and it is definitely going to make it easy. Mary's asking, if a client signs a scope of appointment today, our appointment is next week. Do I wait until after the appointment to sign so that I can honestly say what I discussed, or do I sign it today and state when the appointment will be? If the appointment is educational, do I wait to sign until the enrollment appointment? Those are really, really great questions,
Those are really
Mary.
good questions.
And I appreciate the thought you put into the different aspects of that.
Yeah.
So do you wait until after the appointment to sign it so you can honestly say what you discussed? No, because the client is the one determining which products will be discussed. They initial those boxes with all the products in there, and it is up to them which products they want to discuss. So you should never be filling out that portion of a scope of appointment. That is where the client initials which products they want to talk about. So that's something that should be filled out well in advance. If you have a preset appointment, you are welcome to fill out that appointment date section of the scope at that time and sign it. But what a lot of people do is wait until the appointment actually occurs to fill in that date, since maybe we need to reschedule, maybe we don't know for sure when we're having that next appointment. Again, if you're starting to collect those now for this AEP, you may not know when you're getting someone on the calendar. So definitely up to you depending on the individual situations. If the appointment is educational, do you wait to sign until the enrollment appointment? So again, Scopes are needed before you can talk about any specific plans or plan benefits. For a Medicare 101 presentation, you wouldn't even need a scope as long as you did not discuss any plans, any plan benefits. Really recommend just having a scope for every appointment, because of course then if the client is ready to proceed with the discussions, you're prepared and you don't have to go back later and have that second appointment. Let's be as efficient as possible on that. Hopefully that answered everything, Mary, but if you still have questions, pop them in the chat here. Vaughn's asking, are we going to have a new scope? So every year, a new scope form does typically come out, usually not until around October 1st. It is, of course, part of every carrier's app kit, and it is a CMS model material. So those should be popping up here pretty soon.
Yes, we do have a generic one that we are working on getting. If you take a look at our AEP toolkit, you'll find in this spot in the compliance section saying that we're waiting on it. So just keep checking up on that for whenever we get that. But like you said, it might be a little closer to October 1st, but
and again,
we will have that.
And again, don't wait on the new 2024 scope to come out.
Yeah, just do it.
If you're collecting a scope today, it is valid for 12 months. Just get them now.
And correct me if I'm wrong on this, but I think that every carrier is legally obligated to accept any official scope of appointment, right? Regardless of, so it's like UHC has to accept an Aetna scope of appointment, correct?
Yeah, more or less.
Technically,
the scope of appointment, again, it is a model material, so it should look pretty much the same regardless of what carrier. Whatever we put on our website is always a generic one that doesn't even have a carrier mentioned.
Right.
So it's generally not an issue. Every now and again, you'll have a carrier that throws a little bit of a fit about it.
Yeah.
But I promise they'll take the app.
Yeah.
We've never seen an app rejected. At least I've never seen an app rejected because someone had the wrong scope from the wrong carrier.
Yeah.
As long as you have a valid and compliant scope of appointment, you should be good. And a reminder, I think this goes into Anna's question, can we submit the scope of appointments with the applications? This is a great reminder. There's really only like one, maybe two carriers that even require you to submit scopes of appointment with applications. You are required to store those for 10 years, but again, only one or two carriers even require those to be submitted with the application. So it's very, very seldom an issue.
Yeah.
Keep those on file as you're required to. Again, with kind of the renewed scrutiny of the scope of appointment, we may see carriers say, hey, we want you to start sending those in again. If we do hear that, of course, you'll be the first to know. But right now, there's only a couple carriers that are even asking for that to be sent in. Peggy's asking, can we save the scope from Medicare Center as a PDF? As far as I know, we can.
I think, yeah, as far as I know, honestly, yes.
Are you talking about a blank one, Peggy, or are you talking about like one that a client has already signed? Because I know you can download those.
Yes, that's I think that's a clarification that we need. I don't know if the one that gets texted out, like I don't know if their generic form you can download as a PDF until after they sign it. Not 100% sure. Call us, Peggy, and we'll have our team figure that out for you.
Give us like an hour to get done with this, and then we'll find out.
Yeah.
Janet, hopefully we already answered this question. You asked about when the 2024 scope would be available and why CMS does not just have a generic one. So again, it's a what we call a model material, which means CMS publishes standardized guidelines that this should look pretty much the same from every carrier, but they are still required to administrate that on their own, mostly because carriers do use a lot of electronic formats. So CMS isn't going to create a universal electronic scope, then puts them on the hook for keeping that system going and storing those potentially. That's a carrier responsibility, which is why they each have their own system every year, particularly on the electronic side. Susan is asking, is the submission process any different on weekends in terms of the 24-hour time frame? So I'm not sure, Susan, if you're asking about carrier guidelines or our enrollment team, but our enrollment team does work 7 days a week during AEP and will submit those apps in a timely manner regardless. Similarly, CMS does not give us any time off for weekends. 48 hours is 48 hours. So get those in as soon as possible. Michael asked, outbound birthday calls, inbound service request calls. I think you're talking about call recordings. So Call recordings, again, only required for sales, marketing, and enrollment calls. Service call would not be a sales or marketing call. Calling someone to wish them a happy birthday would not be a sales or marketing call. Certainly wouldn't be an enrollment call. Someone needing a new ID card or saying, hey, I think I need a new rheumatologist. Can you help me find one that's in network for my current plan? Things like that. Service calls not required to be recorded. And then following up with that, if someone calls us, maybe a referral, do we need permission to contact form before we can call them back, maybe from a referral? So if someone calls into you, they are starting a business relationship with you, and you can call them back unless they ask you not to. But if someone is calling you on that first call, I would strongly recommend getting some form of permission to contact, or better yet, a scope of appointment, so we can reach back out to them and have a subsequent appointment with them. Or if someone responds to one of your mailers. So yes, if someone responds to a mailer with a filled out form, that is a permission to contact form, as long as you're using approved methods. Like an approved piece that has a valid permission to contact form built into it, that would be permission to contact. Carol is asking, in a health fair setting, are you able to collect scopes of appointment or only permission to contact? This is a great question, Carol. I'm glad you brought up events. This depends on the type of event you are hosting. If you are hosting a registered sales event, you can collect scopes of appointment. You can actually even take enrollments at a registered sales event. At an educational event starting this year, you will not be able to distribute or collect scopes of appointment. You will not be able to set future individual marketing appointments with beneficiaries. You will be able to distribute and collect permission to contact forms, so you can reach out to those folks later and set appointments. Great question.
Very good question. Can you do a newsletter to clients about new rules that affect them, such as how the scope of appointment will need to be re-signed, remind them calls must be recorded, and things like that?
I typed one up this morning that we could send out to you folks.
Yeah.
This is a great idea. Great minds think alike, Yvonne. I really appreciate where your head's at. And yes, this is a great idea. Mid-year communications with your clients is something you should absolutely already be doing. But a specific mid-year communication about some of these new rules is a great way to prep your clients for what's to come, do mid-year records updates to make sure you have their drugs and doctors, as well as get that next scope of appointment signed. You can either send out a physical copy with this newsletter that they can sign and return, or offer them the ability to call, email, whatever, if they prefer to do a text or email or some other virtual scope option. So really love that idea. Do we know which carrier requires you to submit the scope of appointment? I think it's still just SilverScript.
I think so.
I think that's the only one I know of off the top of my head.
Yeah.
If we're doing an electronic scope, how can we leave the appointment date blank? Michael, that's probably going to depend on what system you're using. I know some carrier systems do require you to put that date in. So if you don't know the appointment date, just make sure you're using a system that does allow you to leave that blank. There are a bunch of different systems that have differing questions. Oh, it looks like you said UHC is what you're using. I would maybe take a look at Medicare Center or another carrier system if that makes sense for you, just to make sure that if you're just collecting one as a matter of practice and you don't know when you're meeting with someone, definitely don't want that appointment date filled in, since we just don't know yet.
Yeah.
Oh, I think that was a follow-up to Peggy's
Yes.
earlier question, and I think we got it answered. Anna asks, if an agent signs the scope of appointment and then a different agent ends up writing the application because the first agent isn't appointed with the carrier the client wants to go with, is a new SOA needed with the new agent's signature? I would absolutely recommend that, Anna. The agent presenting the plan needs to be the one that the client is consenting to meeting with. In some compliance trainings from carriers, we've actually seen a lot of issues with people, the person presenting plan benefits is not the one signing an application, and carriers and CMS tend to view that pretty unfavorably. So if the client ends up meeting with a different agent, I would get a new scope of appointment with that agent's signature that's actually writing the application. Do you guys submit applications for clients on our behalf? Sorry, new to this and trying to understand the relationship with SMS. Anna, yes, we absolutely can do that through our enrollment department. So if you do have paper applications, as we mentioned earlier, make sure you fill out that application submission agreement, and then you can securely fax or securely email those to us for review and submission. Our enrollment team will spot check those for any errors, and then if there is an error, they will get those back to you for the corrections that are necessary. Or if it looks good, they will submit that, and then every day around 4:30, they send reports out to agents for any apps they've submitted on their behalf during that day. So definitely use that for any of your paper apps.
I do not see a way to leave the date completed off of the 2023 Medicare Center scope of appointment. The question states, state appointment completed, which is why I always fill it out after the appointment.
Yep, definitely understand that. As per CMS guidelines, even right now today, you do have to have that scope of appointment before you present plan benefits. So I would definitely be completing those before you have an appointment. Again, it can be 2 minutes before the appointment right now today, but especially going forward, will need to be 48 hours. I would expect some updates as we continue to update things for Medicare Center for 2024. Again, this is a new thing. It's a change. There's a lot of stuff that is not quite up to par with these new regulations that do not take effect until the 30th of September. Mary saying the client has completed their section, I just don't sign off on mine. Perfect. Yep, the process is not going to change. As long as the client has completed theirs 48 hours in advance, then yes, there's no reason for you to sign your portion until the appointment occurs. Would still go ahead and sign it, when they show up or when you hop on the phone with them, whatever the case may be. But definitely, it seems like the problem's kind of solved itself. So I think we're on the same page now.
Perfect. Alrighty, guys, looks like we don't have any more questions, but we're going to be here for just a minute or two more. Please feel free to throw in those questions here so that way we can get those answered for you. There's a lot of resources that we've mentioned today, a lot of links and stuff like that, especially like at the beginning of the webinar. I will have those linked in the follow-up email. So if you want to find those, just wait till tomorrow afternoon and you will have those in your email. And of course, if you want to call in a senior marketing specialist, we're happy to get you those links as well. But please feel free to throw in any lingering questions that you have. Anna's saying you might have gone over this, but what is the reasoning for the 48-hour rules? Because a lot of people ask.
Absolutely. The 48-hour rule is a really fascinating piece of regulation. It is actually a piece that has been around before. It is back with a vengeance, as they say. Yeah. So about 10-ish years ago, the scope of appointment was first born out of necessity. There was a lot of unscrupulous actors in the Medicare Advantage market. Again, it was a very young market at that time that were using some unscrupulous high pressure sales tactics. Medicare Advantage was still kind of a new thing and people didn't maybe understand well enough what they were signing up for. Right. So CMS said, listen, we've got to figure out a way to stop this. People are getting enrolled in plans they don't understand, that are not good for them. What do we do? So they said, okay, for every single Medicare Advantage enrollment, you have to collect a scope of appointment. It's going to specifically outline which products you're going to discuss. That way you can prove that the client knew you were discussing a Medicare Advantage plan and didn't think it was a MedSup or think it was something else. And then we're going to require you to wait 48 hours before you go back and actually present a plan to them. That gives them a 48-hour, at the time we called it a cooling off period, that gave them time to think about their decision. And if it was actually what they wanted to discuss, it basically was about giving the client the ability to opt out of that sales conversation that they maybe didn't want to have, and reduced any pressure that they were feeling to talk about a product they weren't comfortable with. In 2018, we got rid of the 48-hour rule. We said, hey, we've been doing this a while, complaints are down, things are going pretty smoothly, let's get rid of it. You still have to collect that scope of appointment, still want to have informed consent with the client to discuss products they're interested in, but we don't have to have that 48-hour window. And of course, over the past couple years, so 2021, 2022, we saw massive rises in complaints across the market, across the country. And the two biggest complaint categories are enrollment without permission, meaning someone did not think they were being enrolled in a new plan. They thought they were being asked about ancillary benefits or, like a standalone product or something like that. They didn't realize they were enrolling into a new plan, and confusion over what kind of plan they have. So that's kind of where the 48-hour rule is coming back into play. It just, again, provides that cooling off period for beneficiaries to, again, kind of reassess what they heard from the agent on the first time. If they were discussing, types of, again, that educational appointment that Mary was discussing, and gives them a chance to opt out of that conversation or back out of that conversation. If you look at the grand total of all of the new rules that CMS put out this year, that's really what most of them are geared towards.
Yes.
Is giving a beneficiary as many chances as possible to back out of a conversation they're not comfortable with.
Right. Yeah, absolutely. So whenever you are talking about the scope of appointment, make sure to emphasize that it is protecting them, and it's make sure it's what your language and your tone around it, I think, will make a huge difference. We know on the agent side it's kind of a pain, but make sure that the tone and the verbiage that you're using whenever you're talking about these scope of appointments is, this is here to protect you. This lets you, if by signing this, you are giving me permission to talk about things and know that you will be treated well as far as like these conversations go. So that's a really good question, Anna. I think having that perspective makes a big difference.
It really does.
On it. Yeah.
And again, treat this 48 hours as a really good opportunity, especially if you're talking about new clients. With your returning clients, everyone already in your book of business, yeah, again, absolutely send those letters out now, get those scopes. You're going to be doing AEP reviews. Let's save some time. But for your new clients, this 48-hour rule is a huge opportunity to develop your value proposition.
Absolutely.
So develop what they can expect as a client in working with you and your agency. Make sure that they understand how you'll communicate with them, whether that's email, text, phone, whatever. Make sure that you can set standards for the type of information you want for them. They sign that scope. You've got 48 hours until you can present a plan. Great time to make sure that you're getting their drug list, getting their doctor list, anything else that may affect their plan choice. That way 48 hours passes and they get in front of you. You've got everything you need to have a comprehensive conversation about their benefits.
Absolutely.
So use that as an opportunity.
For sure. Alrighty, guys. Well, it looks like we don't have any more questions. Thank you so much for all the questions that you did ask. We love the interaction. We know that a lot of these sorts of things on this day are very like nitty gritty, very specific sort of things. And we know that you all take your job very seriously, and we love seeing these questions and seeing how you guys think through it and everything. If you ever have any lingering questions, please, please, please call Senior Marketing Specialist. If you have to question it, call us. We're happy to help you out. Chalon is our compliance officer. He is here full time, so please feel free to call. We want to make sure that you guys have peace of mind going into this AEP, knowing that you're doing things right. So yes, thank you so much. We do have one more question, Anna. Are they allowed to send prescriptions before 48 hours?
Yes, Anna, you use that, pardon me, use that 48 hours to collect all that great information. You cannot present a plan or plan benefits prior to that 48 hours from the scope being signed. You can still communicate with that client and say, when we are able to discuss benefits, these are the things that we'll need to make an educated decision. And you can absolutely collect your doctors, collect your drug lists during that 48-hour window. It's a great time to reinforce the value you provide to that client and distinguish yourself from maybe a sketchy overseas call center or even the agent down the road that has a different process. So use that 48 hours to your advantage. And thank you for having so many great questions today. Absolutely.
Yes. Thank you so much, Anna. Alrighty, guys. Well, this recording will be available later today. If you're watching the recording, thanks for watching it. But we will see you all tomorrow to talk about carrier resources, walking through some of those portals, giving you some tips and tricks. Thank you so much for joining us today, Chalon. Thank you.
Of course.
Awesome. Thank you, guys.